There are so many different types of anxiety meds out there, some of which might cause dementia. Sometimes they might lead to addiction. And oh, maybe they're only for short-term use instead of long-term. So how do you know which one you should be taking? So I started this video not actually for you, but for me. So I've been on Lexapro for like 5 years now, and it's reached the point where like it's no longer working for my anxiety. Like I am staying up at night, I can't fall asleep, I am worrying about everything. So now it's about the time when I need a new medication. And so I started my standard spreadsheet of everything. Like here are the pros and cons, and here are the ones that I might want to try and might not, and why. And then I realized like, hey, this information is actually super useful to other people too. How do you know which ones to try and when to stop? Well, first, in general, talk to your doctor. And this is why I'm making this video, is because I'm using this to speak with my doctor. I'm becoming informed before I go there and speak with her and say like, okay, these are my next ideas in terms of what I want to try, but I really want to hear your perspective on this too. And the other main thing to think about when it comes to anxiety is like, what things can you and can't you handle? So for example, I do not like the physical symptoms of anxiety. If a drug makes my heart rate increase, yeah, that's very bad for me. And there are certain side effects that I like just can't deal with. So when you think about these things, think about your deal breakers and think about what you want out of this type of treatment. Because some of these are like short term, like, oh, I just need to be able to fly or give this speech. And some of these are more like long term, like, yep, nope, I have a problem every single day and I want treatment for it. So let's start with the most commonly recommended treatment, and this is SSRIs, so selective serotonin reuptake inhibitor. Now, the problem with these, so the SSRIs and the SNRIs, which are also very commonly used too, is that it basically takes a long time for them to start working. So this is not like a I have a speech tomorrow thing. This is like a I cannot fall asleep and it's been months thing. So SSRIs and SNRIs, we're talking about sometimes months in order to start feeling an effect. So if you want more of a short-term drug, yeah, this is not it. Now, the SSRIs are things like Zoloft and Prozac and escitalopram, so Lexapro. So those are the kind of most commonly prescribed ones because A, they're cheap, and B, they work decently well. So they have some of the highest efficacy rates in terms of the medications out there. But SSRIs are also well known for having kind of terrible side effects. So typically people will experience things like constipation, dry mouth. They might have weight gain. And one of the most common ones is, yeah, sexual dysfunction. So sometimes doctors will start prescribing the SNRIs instead of the SSRIs because of that sexual dysfunction side effect. Now, both SSRIs and SNRIs work extremely well for things like anxiety. The SNRIs are going to be things like Cymbalta, and they do work as well. They have problematic withdrawal, which SSRIs do too. So SSRIs cause things like brain zaps. SNRIs maybe a little bit more problematic withdrawal, but both of them are kind of terrible to stop. And as a reminder, you have to use them for long periods of time. So this is something that is likely to cause withdrawal once you officially stop it. And not only that, since it takes a while to start feeling the effects, you might have more anxiety during like the first week or first month. So SNRIs might actually be more recommended if you have other symptoms like migraines or pain or fibromyalgia. If you have those at the same time, SNRIs might be better for you. Now, they've also tried other types of antidepressants like tricyclics and MAOIs. Now, MAOIs are rarely prescribed because they have a whole bunch of problems associated with them. Like, you just basically can't eat much of anything if you're on MAOIs. So those are like the last form of treatment. But the tricyclics might have some benefit for anxiety. We have much less on them than we do on the SSRIs and SNRIs. Now, buspirone or Buspar might actually be recommended too, but this is a little bit less effective in general compared to the SSRIs and SNRIs. So this is kind of like the next type of treatment, like maybe those aren't working for you, maybe you can go to this. But here's the thing, this is linked to things like movement disorders and nausea, and a lot of psychiatrists actually suggest that it might be kind of underdosed. So people who are taking this might not be at a high enough dose to actually feel the effects. So maybe that's linked to its efficacy problems too, because the SSRIs, again, kind of work better. And then you have things like the mixed antidepressants, so things like mirtazapine. And this works as both something that increases serotonin, but also is an antihistamine. So this can make you a little bit sleepy, which some people love. Like as a person who can't sleep, I'm like, let me take that sleepiness side effect. I will take that any day. This is actually recommended a lot for like elderly patients, and it might have fewer of the sexual side effects, but it could still cause weight gain. So they're suggesting that this might not be as effective as an only therapy. This might be good like in addition to other things. Then you have things like bupropion. Now, bupropion has kind of a little bit of a controversy associated with it because some people say that it increases their anxiety and some people say that it decreases their anxiety. There's not a ton of information on this. And again, this is one of those drugs that is better or is more commonly commonly used as something like an adjunctive treatment. So you're adding it in addition to other things. Now, anecdotally, I once took bupropion as a way to actually help me quit smoking, and yeah, I lasted about a day on it. That made my anxiety terrible. So I'm kind of with the controversy on this one, but for some people it works well and for some people it doesn't, and when it doesn't, it really doesn't. Now, next up in terms of main categories, you have the benzos, so the benzodiazepines, and these work by increasing GABA. Now, these are extremely controversial because they are typically only prescribed for short-term use. So this is something like a Xanax or a Valium that you're getting to like help you on that plane ride. You should not be taking that typically long-term. Like, a lot of people will not prescribe these long-term because they have a high risk of things like addiction and dependency, and they're also linked to things like dementia. And not only cognitive impairments here in elderly people, but we're talking about people in like their 30s and 40s. So benzos long-term can be problematic, and it seems like people typically have to stay on them then. And then even when you try to quit, like maybe that increases mortality too, although this is correlational, not causal. And then you have the weird other drugs. So you have things like anticonvulsants. So these are things like topiramate or pregabalin or gabapentin. Now, they haven't been as tested for anxiety. They've been tested for a wide variety of other things. So again, like neuropathic pain. So if you have other symptoms like neuropathic pain along with your anxiety, these might work for that. But gabapentin and pregabalin, also very controversial. So long-term addiction risk, also implicated with things like dementia. I made an entire video about this. If you want me to go on that controversy, go back and watch that video. In terms of short-term, we have things like propranolol. So propranolol actually decreases blood pressure. It actually decreases things like your heart rate, which is one of the major side effects of it. But it also seems to work for things like panic attacks. So not like those long-term anxiety symptoms, not as much the GAD, but more of like the panic disorder. And hydroxyzine is also potentially really good for things like panic disorder too, which is actually an antihistamine. But again, we don't have as much on those things. And then there's also some of the weird ones like antipsychotics. Most people do not recommend these. Antipsychotics have terrible long-term side effects if you're taking them for long periods of time. So antipsychotics are sometimes used in like worst case scenario, but they're rarely the first line treatment. Now, as you see, all of these drugs have their own problems. So think about what things are going to be in your wheelhouse. Do you want more of a short term? Do you want more of a long term? Do you want to try some of the things that are untested, like kava or CBD or acid? Or do you want to stick with a tried and true medication out there? Like, these are things to talk about with your doctor, but at least now you know the generals about everything and what's out there so that you can have a more informed conversation.